Fell for that classic Washington trick of follow the smell of bacon. You did find the right room. I just apologize. It's a little healthier than you might have expected, but it is very good breakfast. Please eat up, and we might all sneak in for a little bacon afterwards. I want to welcome you to our briefing. We'll get the official title as we get launching into this. This is a briefing on short-term fixes, long-term consequences, how vaccines, viruses, and dollars impact emergency preparedness in America's cities. We are very fortunate to have, I don't know if you can sense Georgia in the room. We have a few rows of Georgia, but we also have some extraordinary co-hosts of this event that are really representing the heart of Georgia and the spirit of why cities matter to our health and preparedness in the country. I would like to first welcome our co-host, Congressman Tom Price, and please, if we get a few words from you. I don't know if you want.
I'll shout.
I have a feeling you know how to.
I'll project from here. Let me add my welcome as well. This is an incredibly important topic and an incredibly important group. My name is Tom Price. I represent the 6th District of Georgia, northern suburban Atlanta. Before I got into this crazy business, I practiced orthopedic surgery in that area for about 20 years. Spent part of my training at Grady Memorial Hospital, which is one of the big city hospitals represented here. I can't tell you how important it is to get big city hospital and healthcare right. So thanks for coming. Thanks for the work that you do. And I know sometimes when we go through the machinations of what happens here in this town, we think, oh, that'll never happen. That'll never happen. That'll never happen. When you think about that, all you have to do now is remember SGR, which nobody thought was going to get fixed ever. Nobody was paying attention to it, and it did. So that's my hopeful message. When SGR can get fixed, then anything can get fixed. So thanks for coming and attending this. Thanks for all the work that each of you do, and a special shout out to Patrice Harris, who's a dear friend and has done a great job for years. And I know it's going to be a great panel. Thank you so much.
Thank you very much. We are very fortunate to have someone from the medical community in Congress with a handful, and that kind of understanding and investment is a key part to why we can keep building our public health strengths. Our other co-host is Representative John Lewis. He's not here right now, but I believe someone from his office is here to say a few words. If not, I'll do shadow puppets for a moment. All right. If he comes in, we'll take a time out to recognize his contribution as part of, again, that heart of Georgia and the work that's going on. My name's Shelley Hearn. I serve as the director of the Big Cities Health Coalition, which is part of NACCHO, the National Association of County and City Health Officials. I know you all knew that. NACCHO, not NACCHO. The Big Cities Health Coalition represents the leaders of the 27 largest health departments in the country. The urban health departments, where really it's where the rubber meets the road in so much of our health work taking place in the cities and the growing suburbs in those areas. Many of our health departments represent not just the metropolitan area, but our county health departments, which have many services, whether it's dealing with chronic disease issues or tuberculosis containment. They also are home to the emergency response of major medical events. This is very brave of all of you to be here at this hour to come and talk about a nice light topic, disasters. And I don't mean to be sounding cavalier or even catastrophic, but disasters happen. We know that they're inevitable. We don't know what they're going to be. And that's part of why it's so critical to have the investments in preparedness, which really come with an all hazards approach, so that you are prepared for whatever man-made threats come along or Mother Nature. And I think the recent events in Nepal the tragedy that is taking place there is just another reminder of the unexpected and the severity of events that can happen. The reminders that we've had in the last decade, ranging from SARS to Superstorm Sandy, have made it clear how much we need a strong public health force. Those are the laboratories, the disease detectives, the hospitals. All of them have to be training together. As Congressman Price had noted, we need to have more and more of the hospitals, public health agencies, all that infrastructure. I can say infrastructure in the basement of Rayburn, right? They need to be working together, and that's where the preparedness investments are so important. We did have those stark lessons from 9/11 and anthrax, and we have the Bush administration and this Congress to thank for the extraordinary investment that has taken place in public health emergency response around the country. It has made a critical difference. There are no more rotary phones in our local health departments. Sounds crazy, but that was the truth at 9/11. We have more epidemiologists on the beat. We have more surveillance and countermeasures. What used to happen was in many local health departments, they were 9 to 5 weekday operations. So if a call came in about a suspected outbreak and a sample was sent over, say on a Friday night at 6 o'clock, you'd have to wait Friday night, Saturday morning. And that's right, I don't wear a watch anymore. It's the iPhone. You'd have the ticking clock going along. It'd be Saturday afternoon, Saturday night, Sunday night. It's not just the coffee. I can already feel my heart getting to go. You wouldn't be starting to get onto the job until Monday morning. And that's because we had not had the investments in capacity and infrastructure in our local health departments to often man the job. It is a much better situation today. Those days used to keep me up worrying at night. But I'll tell you, after the decades-long investment in that all-hazards approach, we are much better prepared. There are weaknesses still, but we are in a place that is in a state of readiness that we have never seen before. I know this in part because years ago I ran and founded an organization called Trust for America's Health, which was an independent public health organization that scored the states on how ready they were for a major medical event. This was not always welcomed and always wanted, but I'll tell you, it was a very clear coverage of how we were doing. We are in a better position today. But I'll tell you from this vantage point, what keeps me up now, what I think is actually our greatest risk to all the progress that we have made, is the decline that is occurring in federal emergency preparedness dollars. You can't expect to be prepared if you're cutting by almost 40% those very investments that get the job done. That's a cut that you will see resulting in reduced capacity of laboratories, less disease detectives, the epidemiologists, the drops in capabilities, and less training will be available. And we have certainly seen, whether it was Ebola, measles, how critical so many of those components are to getting the job done. At the end of the day, this kind of variation in funding is not healthy. It's a roller coaster ride that is not going to get us ready. So let me just leave you with a few thoughts that in this time of limited resources, we have to make very strategic decisions with the highest return on investment. And we need to look more and more at what our cities are doing. The cities are where leadership for much of these types of responsive events exists, in addition to the innovation of health preparedness is taking place. And while overall emergency preparedness and response funding should be increased, we need to be thinking about funding allocations that reflect the scale of the threats and the impact in these high, densely populated areas. So if you want the biggest bang for your buck, think about funding directly to the cities. Currently, only 4 cities, New York, Chicago, Washington, and LA, directly receive federal dollars for those preparedness efforts. The problem we have out there is that the CDC funding going into emergency response, CDC can't tell you how many of those dollars actually get to our cities. I can't tell you, based on those CDC dollars, what is happening and how much in the end gets to some of our key major urban areas. And that's not acceptable in this time and day. So we have before us, we'll get the kind of real stories, the insights from the front lines from 4 city leaders. We've got LA, Dallas, Fulton County, which covers lion's share of Atlanta, and also Chicago. Their insights on the recent Ebola event and measles, I think, will help us give a better sense of what worked, what didn't work, and where we need to strengthen our areas in terms of a better, stronger public health emergency response. I guess the good, the bad, and a little bit of the ugly. So let me introduce the good.
And their support for health in Fulton County. As Shelley said, the Big Cities Health Coalition is a forum for the leaders of America's largest metro health departments in the country's most urban areas. We currently have 27 members. We exchange strategies. We jointly promote and protect the nation's health and safety for a healthier America. Together, all of our members serve about 1 in 6 Americans. Our member health departments dedicated time and resources in a number of ways to address both the Ebola outbreak and the recent measles outbreaks, which the panel will speak to more specifically in just a moment. With both outbreaks, our members and our member health departments provided information and education to the public and healthcare providers, including, and I'll say a little bit more about this at the end, working to tamp down the fear surrounding Ebola and the misinformation, the lack of information based on science about the safety of routine vaccinations, such as MMR. Our member departments monitored patients with actual cases of both diseases. We did the contact tracing. For those of you who don't know, contact tracing is you have someone who's identified who has the disease. We need to go out and trace their contacts, meet with all the folks that came in contact with those folks. And so we did the contact tracing among those who may have been exposed to either disease, and in the case of Ebola, conducted airport screenings. Local health departments also coordinated with health systems and hospitals, as well as state and federal governments. They drilled to make sure appropriate measures were in place and known to staff. And they also set up incident command centers as needed. In regarding to measles, health departments provided immunizations and worked directly with schools and daycare settings to make sure that they had the information they needed and necessary immunizations to keep their students safe. Now, responding to these emergencies sometimes meant that other work didn't get done. Local health departments, even some of our BCHC members, who in most cases are better resourced than average, often operate at the margins, and both events took a majority of staff time, epidemiology staff time, and preparedness staff time, really causing other routine investigations and surveillance to be put on hold. For example, monitoring of the flu and foodborne illness outbreaks. Now, while health departments prepare for such surge activities, it still compromises their ability to conduct other important work that has real value to protecting the community and keeping it healthy. To mitigate future disruptions, we cannot emphasize enough that emergency preparedness demands a long-term approach with sustained and consistent funding rather than piecemeal funding streams. Public health departments can only be nimble and effective in response to crises if they are able to prepare and prevent, rather than being forced to play catch-up with dollars and resources after disasters occur. Now, I want to say a little bit about Fulton County. And I have to say that in this instance, I believe that in Georgia and in Fulton County, we did have our finest hour when it came to our Ebola response. Now, clearly, you all know we have great assets in the county or near the county. We have Hartsfield-Jackson International Airport, and that is a major hub for international travel. We have Grady Memorial Hospital, as Representative Price stated, and we have Emory University Hospital. So we have great assets there. Even with those great assets, it is critical for that collaboration among the local health districts, the state health districts, and the CDC, because that is another huge asset right in our backyard. And that happened with our Ebola response. There were weekly Ebola calls with the state in all of the 18 health districts in Georgia. Now, certainly with Hartsfield being a major hub for international travel, again, the metro area was probably most likely to receive a traveler. But it was really important that all of Georgia felt ready to deal with the Ebola virus disease. And so for that matter, we did have these weekly phone calls with all the districts. And it was critical because we shared information. We shared what folks were saying, what folks were worried about, what our citizens were worried about. And I believe that that really helped in our coordinated and collaborative response. I also have weekly senior team members and meetings, and I have these meetings with all of the members of my 2 health teams. In Fulton County, I'm responsible for both public health and behavioral health. Talking about the fear a little earlier, understanding that fear from a behavioral health lens was key. And so we were able to meet weekly and have those conversations because folks were coming to our clinic for their WIC services. Folks were coming to our clinic for other services, and they were worried about the Ebola virus disease. They were worried because they had heard the rumor that somebody came into a WIC clinic and had the disease. So it was important for everyone on the senior team to be informed, not just the folks that were on the front lines with Ebola, and it was important that we share that information. In addition, I report to the county manager in Fulton County. We have weekly executive leadership meetings. I raised the issue of Ebola at every one of those meetings because staff were also afraid. Staff were traveling. They had relatives who were traveling. They had relatives who were coming back, and they really wanted to know what to do. And so I was able to share accurate information at those meetings as well. Now, one of the things that we said a lot, again, was let us worry about handling this disease. But in order to do that, the citizens have to trust the response of the local health department. But we said that a lot because folks wanted to do something, and that's natural, but we said, let us do the work. We will keep you informed. We will give you the information, but let us worry and let us do the work. And I'll tell you, we got a lot of positive response from that. And I think it really went a long way to dampen down that fear that I talked about earlier. You know, some folks have asked me what best prepared me for my work in public health. And some of you know I'm a psychiatrist by training. And I have to say that training, my psychiatric training, has gone a long way as I work in public health. So again, I want to highlight that while it was our finest hour in Fulton and with the state, we did a great job with that. We're doing a great job with our vaccinations rates regarding measles. There's still more work to be done. Funding is a critical issue, as you'll hear more from the other folks and perhaps from Shelley. And so it really is a time to raise this issue of awareness. We need to be prepared at all times and not just sort of reacting to these epidemics as they come along. So I thank you again for your time this morning.